In this lesson on adjusting boundaries, we will explore the current state of your relationships and create a deliberate plan to provide healthy boundaries. This is step number 5 on the reflection activity. We know that adjustments to boundaries can be difficult. The situations you are dealing with may feel and be complex. There may be times when the options seem few. However, we are here to say that there are many ideas and resources available to help you make these adjustments. In fact, there's so much to cover on this topic that we have planned to make a full course just on helping caregivers with this part of their lives. Because as you can see, after completing step 4 in the previous lesson, the boundaries are necessary if you are going to have the time and energy to nourish all of the relationships in your life, including time set aside for yourself. So, make sure you have your workbook and have completed the previous 2 lessons. You will need those before moving on to this step. Once you are ready, take a look at your me circle from step number 2 and focus on the drawn circles that are overlapping your circle in an unhealthy way. The ones that are overtaking your circle. In this example, I would write recipient of care. Write those names in your workbook on the left side column of step number 5. Now, go back to your drawing and imagine that you are moving those overlapping circles to a healthy place, to where you drew them on step number 3. As you visualize this space opening up on your me circle, take a deep breath and take a minute to think about how that feels. This is an important step because understanding your feelings around these boundaries will help you as you work to adjust them, which we will talk more about in a few minutes. As you thought about moving the circles out, what thoughts did you have of things that might need to leave your circle? They probably included things that have taken over your time, your space, your emotional energy, or your finances. Take a few minutes to think about and identify which situations would have to change in order for those circles to be in a healthy space. Keep your mind open and just write your ideas down in the right side column in step number 5. This is not the time to analyze whether the idea is possible or not. Just write it down. Hopefully you have a pretty good list now of what you could adjust to achieve healthy boundaries in your social circles. Over the next few slides, we will also provide some thoughts and ideas that you might consider adding to your list. Before we do that, though, let's take a minute to address the feelings you have about adjusting these circles. If you feel excited, empowered, happy, or a new sense of freedom, that's good. Hang on to that. If you're feeling guilt or guilty about actions that you know you need to take, you might make a note to review or complete the guilt regulator activity. If you are feeling overwhelmed, you could review or complete the sorting your spheres activity or the stress thermometer activity. You might also wish to practice mindfulness using the audio from Kimberly Beecher to help calm your mind. Now, the first and most likely relationship that may need adjustments is with the recipient of care. The first step in setting boundaries with your recipient of care is to have open and honest communication. As we mentioned before, the ability to do this will vary depending on the cognitive level of your loved one. But setting a precedence of talking through things, even if they are difficult topics, will help eliminate misunderstandings and hard feelings or resentment towards your recipient of care as you work together to find solutions and common ground. If you are new to the caregiving role, make sure to set expectations and boundaries early on. It will make things easier in the long run. If you've already been doing this for a while, get clear on what boundaries you need to set or adjust, and then set up a time to talk through them with your loved one. We know this can be a challenging step, but it is so necessary. It may be helpful to talk with someone who supports your vision for boundaries to get encouragement and additional support. Next, you should create a plan of care that honors the boundaries you have set and discuss options for other caregivers who can provide breaks and respite care if needed. We see and hear challenges of setting or adjusting boundaries from many caregivers, so you are definitely not alone. Next, we'll share a short video clip from Sean, the primary caregiver for his mother, and from Dr. Brosey, a renowned psychologist in geriatric care.
Yeah, for me as a caregiver for my mother, the hardest part is definitely trying to balance my love for her and my respect for her as my mother with what has to be done. And that's so difficult to there's two completely different things sometimes, because I want to be the loving, kind, obedient son who does what my mom wants me to do. That's how I was raised, because she's so strong and independent. And then my wife has balanced me out saying, you got to put your big boy pants on now, and you got to tell your mom, no, you got to tell your mom this is how it is. And my wife was absolutely right. I had to come to grips with, because I love her, because I respect her, I need to help her in a way that I wasn't comfortable with. And I'm still dealing with that on a regular basis. While setting boundaries between my mother and my caregiving role with her and my family and my work is one of the biggest challenges that I face, and even my personal health, because it's so easy to let my mother dominate what I need to be doing every day, or set the pace for what I need to be doing, or take me away from things that I need to be doing. Now, she doesn't mean to do that, but it just happens. It happens because I feel a sense of duty and responsibility to help her. It happens because I love her. It happens because I think, what if I were her? But I feel I'm still coming to grips with how to balance that. And it's really, really difficult to allow her needs to overwhelm my emotions, first of all, my mental, my thinking, and to have some sort of a balance, and even step back and have some boundaries that can allow me to give her care, but allow me to be effective as a father, as a husband, in my work in the community, in my work, my own career. It's been a challenge. It's been a huge learning curve for me. My mom wants to call me 12 times a day or 20 times a day. And I've had to set, just in that instance, just one clear boundary, that I will talk to you one time a day. And I had to tell my mom, I love you so much. I'm going to talk to you every single day. And however, I'm not going to be able to talk to you more than once or maybe twice a day, because I have so much going on with my work, with my family, with the rest of my life. And I'm sure you understand that. And she said, yes, I do. But that doesn't mean she won't call me 20 times a day. She still does. And she still is very demanding and obsesses over things all the time. And I just have to, she calls and I listen to those messages, and I probably need to back off on listening to the messages even, because it's overwhelming. And I think about the messages that she's giving me, all the time. But at least in that one way, I've learned I can do one call a day with her, talk through things, and I'll let things pile up. And then the next day I'll call her once. And my cousin is a caregiver of her mother who has dementia, just like my mother, and they're sisters. And my cousin had to learn that too. She gave me that great advice up front. She said, you got to set some boundaries.
One of the important things in being a caregiver is self-care. And let's go to another major role of caregiving, and it's predominantly women get roped into it more than men. But an opportunity to care for children. And many times in therapy, where I've worked with women, I've heard essentially that they've lost themselves, that they find that their hobbies have gone away, their socialization has gone away or reduced. And it is a tremendously important thing, and sometimes because I went and saw this clinical psychologist and he or she said I better take better care of myself, it helps people to have some permission to do that. For me, being a caregiver for older adults, it's very much the same thing. For instance, when I'm out in the sun sailing, if I don't watch it, I can lose my skin color as it is, and it can become red and I can be sunburnt. If I don't watch it, I can become dehydrated. Even though I'm doing something I love, sailing, it can have an adverse consequence to me, dehydration, which can cause physical problems, and an adverse consequence for me. And if I'm on a boat, if I'm not taking care of me and I'm the captain of the boat, adverse consequences for my crew if they don't know how to get back to the dock. Being a caregiver for older adult, it's very much the same thing. The importance of self-care. You might even think about it building a moat around yourself, around your psychological well-being, around your social network. In other words, how do I keep it intact? How do I keep that protected so that caregiving doesn't take away my socialization? Caregiving doesn't take away my hobbies. And then paying very close attention to your psychological well-being. We know that many times caregivers become very depressed. Why? Their world has shrunk. They begin to see less of the world. Why? Their world has shrunk. And many times with care, like for me, if I'm involved with patients or working with families, I'm looking through an objective lens. When you're a caregiver as a family member, you're looking through a love lens. And in that, you're also, when caring for your loved one, you're seeing how they are now. At the same time, you're replaying in your brain what they were like before. Those two things at times struggle with each other and can lead to a great deal of frustration. So if somebody says, I'm overwhelmed, I'm drowning, and we hear those kind of things, it often will lead to resentment. But stating publicly that you're resentful caring for your mom or your dad is tough to say in public, so you suffer in silence. So if you find yourself in that role, many times people come and see somebody like myself, and it's amazing at times where I will say something, in essence, giving them permission to be appropriately selfish, to guide their own ship. It's just like for a parent with kids. Kids are, Mom, Dad, I want, I need. No, they're egocentric. I want it. And if you don't watch it, you're giving, and you go, hey, where did the last 10 years of my life go? Being a caregiver, say somebody has dementia or they have some type of physical disability that requires you to be very involved, before you know it, you can lose yourself. That's where that moat comes in handy. But seeking help from a support group where you hear other people say the same thing, doing reading about caregiving. And I think a critical one is to recognize all of us at times say something at a particular time in our life that later we don't live by. We change our mind or all kinds of things. So sometimes caregivers say, I promised Mom or Dad I'd never put them in the Happy Hills facility. Well, that's what you knew when you were younger. But there are certain times where the caregiving becomes so profound and so overwhelming and so pervasive. The right thing to do is to let Mom and Dad have the opportunity to have professional caregivers. Your role then becomes son or daughter. It allows a freer eyebrow to eyebrow, heart to heart relationship rather than a physical caregiver trying to meet all of their needs.
When it comes to setting boundaries with others in your life, whether that's with your spouse, partner, children, extended family, others at work, or in the community, many of the same principles apply. Open and honest communication will address the situation head-on and allow for discussions that can provide help and solutions. Being honest also allows you to say no in times when it's needed. Remember to respect differing opinions and points of view. Be sure to set expectations and boundaries early on if possible. And most importantly, make plans to work together as a team. As I said in the beginning of this video, there is so much to cover on this topic that it can't all be covered in one video. If you are interested in joining the waiting list for the full course on boundaries, please check the box on the feedback survey at the end of this chapter.